Hello, Move Nation. It is I, Jonathan, and I come to you from Move Remote HQ, as usual. Today, I have an interview with my dear friend, Dr. Patrick Hall. Patrick is a primary care physician for Kaiser Permanente, and you might remember him from such films as Kaiser commercials. Go check him out on YouTube. That's right, Patrick is the face of Kaiser, and he is also a Move member. He's been with us for about 8 years. He is an excellent athlete, well-tatted, well-chiseled. You'll likely see his name at the top of the leaderboard every day. We dig into all of the normal topics, like how he started with CrossFit, what his athletic background was, what his thoughts are on priorities and goal setting. But we also got into how his experience inside the gym affects how he interacts with his patients outside the gym. And I just thought it was really neat to hear how those experiences carry over. So, as always, please give it a listen, and I hope you enjoy it. Well, when I think about a doctor, particularly a primary care physician, your image doesn't really exactly come to mind, right? So you've got you used to have the beard. The beard would pass for a primary care physician. That's passable. Maybe that's your like Clark Kent glasses.
Yeah, exactly.
But you got the cool haircut, you got the tattoos, you're super buff, so it's like my doctor growing up sure as hell didn't look like that. Sorry, Dr. Simmons. But, if somebody saw you on the street in your civvies, they might think you were a rock star or something, but probably not a doctor. And in truth, like most doctors I know aren't the healthiest of individuals.
Sure.
A lot of them are overweight, overstressed, don't exercise, hardly ever see the light of day. So why do you think that is for health practitioners in general, but also why is that not true for you?
Well, it is interesting because I think it's sort of an interesting system that we have set up with with American medicine and how we train, and I think the way we train is not always necessarily conducive to a healthy lifestyle, and so it's I think some of that has to do with the reason you don't see a whole lot of providers who do a ton of fitness stuff is because they're just because they sort of have that mindset where your job is your life, and you work and you work a lot, and that's kind of who you are. Yeah. And so it is interesting though, because we're on the front of promoting healthcare, but yeah, you're right. There's I can probably count on two hands my coworkers that do something remotely like active and so forth. So it's I think it's, like I said, I think it starts early. I think it starts during school and during training where you're worked pretty hard. And people just don't make time for anything outside of those things. And so I know for me, the whole reason that, I may have told you the story or not, that my intro into CrossFit was my last year in medical school. And I'd been, doing the school thing, not really exercising at all, probably eating too much. And so I was showing my mom some, after I'd come back from that Honduras trip, I was showing her some photos from, the trip. And we had done this hike where we climbed up to the top of this mountain there. And it was like a couple of guys, we all had our shirts off and we were like posing. And my mom was like, "Oh, you've been skinnier than you are now." Or something. It was sort of like an offhanded. She didn't mean it necessarily in a mean way, but it was like you could tell that. And it was true. I was looking a little soft, so
okay.
I immediately signed up for like the CrossFit gym in town like that week. Right. She said that, and it stuck. So, and it was good because I had sort of dabbled with exercise during med school, but nothing really nothing with any consistency. And so pretty much from that point onward, I sort of carried it over. I moved here probably 5 months later. and established with the gym about, a couple weeks into moving here.
Yeah.
And that was huge for me because, going through residency and the hours were, they're not great. And so it was really nice to have a little bit of, I needed the gym, during that time to really kind of keep my sanity. So it was, for me, getting into it. Yeah, the physical fitness aspect of it was great, but it was more than anything, it was the mental aspect of, some decompressing. Because you kind of, I feel like there was in residency, it was sort of like 3 years of you're kind of constantly on this like low level anxiety of like something's going to go bad and you're going to have to jump into this like high stakes situation. And so it's always kind of, so that you really need something to kind of de-stress. And so that the gym for me was the way to kind of, once you got out of the hospital, a way to kind of unwind.
Right. And a lot of times you were working those overnight shifts, right?
Yeah. I think the toughest, I was pretty consistent with the gym throughout residency. I think the hardest time for me was there was a month where we had to work night float, which is essentially 12 hours overnight, 6 days in a row. You get 1 day off and then go right back to it. Yeah. And you do a month of that. And so that just physically, beat you down. And so I would come in, like, I guess it was probably the 8 a.m. or 8:30, whatever class that was, because I'd get off at 7. So I'd make myself do it and then like go home and eat and crash. So, it's, people that do 12s, it's impressive if you can squeeze workouts into that. I know Eddie has to do that too, because it's just, that's your body's so kind of torn up after 12 hours that it's hard to kind of force that exercise component afterwards.
Yeah. You said you really didn't do much before CrossFit. Mm-hmm. Did you do any sort of exercise or sports activities or anything like that when you were growing up?
Yeah, I guess I should have framed it a little differently. I definitely growing up kind of did everything. But it's interesting, as a kid, you just kind of do everything. So I did all this, played a little soccer, played basketball, baseball. In high school, I ran cross country and played tennis. So I did, and that probably was huge because at an early age, you're like, okay, this is kind of what getting fit involves. So you kind of have some framework for it. I definitely sort of disappeared from the exercise scene once I was in college and into med school. Like that just fell off, and then your body makes you pay for it because you just can't get away with it like maybe I could have when I was in high school. But when I was in high school, I was just running all the time, and so that just kept me thin. So, but I'd actually never lifted weights. That was sort of a new thing when we were distance runners. So our day just involved in high school was just running miles over and over again.
Right.
So we really never got in the weight room. So I didn't really lift a weight until at med school, essentially. And it was like shortly before I got into CrossFit. So, and it was, where the concept of resistance training actually happened.
What led you to seek the medical school route and becoming a doctor and all that?
It was sort of a fairly winding road for me in college. I switched majors probably 3 or 4 times.
Okay.
I don't know if I told you, I initially went into college as a theater major.
Oh, that's right.
Yeah.
You're you're a founding member of the Move Community Players.
That's right. Yeah. So in high school, I went to a performing arts high school for half a day. And so when I went into college thinking I was going to be, the next big actor or something, I quickly grew tired of that. And so kind of bounced around. I was an English major briefly, and then switched over to biology. And I worked in a lab in college, like a basic science lab, which was fun. It was really, really good experience. But working in a lab's a pretty isolating experience, particularly I was in a small lab, and it was, they were, I'd go in there some days and be the only one there just doing stuff. And that wasn't for me. I needed a little more human interaction. So So med school, it seemed like at the time, like, oh, that sounds like a pretty good combination. It's got the science aspect, but really a huge part of it is communicating with people. And so that it was sort of a nice balance of the things that I enjoyed, because I'd always enjoyed science, but, the theater growing up, kind of doing theater as well, kind of made me enjoy, the humanities side of things. So medicine's a nice combination of, science and humanities.
Yeah.
I actually did, in college, I was one of those standardized patients who act for the medical students, where you'd tell them things like, I've got the worst back pain. I need an MRI immediately. It was so great.
It's like,
so
you always get a standing ovation.
Exactly. Which,
bravo.
I feel like that was like it was one of those sitcoms that has definitely spoofed that the medical. I think Kramer did that in Seinfeld.
Right.
Yeah,
that is awesome. How long have you been a member at the gym?
It would be since it's almost 8 years now, because it was summer of 2012. Yeah, so June 2012. So coming up on my 8-year anniversary pretty soon.
Awesome. Congratulations.
Thank you.
So you were at Carolina CrossFit or something like that, right?
Yeah.
Yeah, and then moved to Decatur to go to school, or to continue school. Mm-hmm. What stood out to you about CFED at the time, and why did you choose to come to us?
It's an interesting story, how you get in that, because when I first moved here, I think I just Google searched CrossFit gyms, and moving where I lived, there were essentially 3 gyms that were close by.
Right.
Actually, I kind of looked around at the websites, and actually, what's funny is the CFED website was pretty solid. So I think from a visual aspect, that was like, in a lot of ways, it was like, okay, this looks pretty nice. I'm going to check these guys out. And so, nice. Actually, in the class schedule that you guys had was like really pretty conducive to, what I knew my work schedule was going to be like. So actually you guys were the first gym I actually ended up at, and after I did my little, intro class, I was pretty much sold. I didn't even really I didn't shop around at that. It's funny. I think that class I worked out with had Chet and I think who else might have been there, but I definitely remember Chet being there. So
cool.
Yeah, and you guys, it's just, and it's always been that way. That it's always been a good community in the gym, and so that's kind of what kept me coming back. So I always felt welcome. It wasn't this kind of some of the gyms, some of the CrossFit gyms can definitely have a little more of that overdriven testosterone feel. So you didn't feel scared off when you walked in the door. So that was good too. So
nice. Obviously, you were doing CrossFit. You said 5 months or something like that. Leading up to this. So you were pretty brand new even when you came to us.
Mm-hmm. Yeah.
What were any challenges you were facing early on, either, I don't know, from exercise or any other challenges maybe?
I still was pretty much brand new to all the movements and everything. So when I moved here, I was still learning all those things that we do in a CrossFit class. So I was I still couldn't really overhead squat to save my life. And, I think handstands still terrified me at that point too. So there were a lot of, because I didn't do gymnastic stuff growing up. So a lot of the gymnastics movements were way outside my comfort zone when I first started.
Yeah. Your body has changed a lot. I was looking back at photos of you from when you started and to now. And obviously you're a lot more muscular, you're leaner, and that's definitely a product of exercise. But has that been a specific goal of yours to change your body composition? Or, is it something that you actively worked on, or is it just product of consistency?
I mean, a big part of it was consistency for sure. I don't think, when I started off, I don't think I set out necessarily that, with specific body, composition goals in mind. I think that was something that maybe came later on. You kind
Mm,
of see that you start seeing those signs of progress as you've kind of been doing it for a while. And then I think that did that, that kind of fueled, um, I think that's what, I mean, not that I would need that to continue going to the gym, but getting that sort of positive feedback from having done it for a while and being like, okay, yeah, I can see there's actually some change going on. I mean, that certainly keeps you coming back for more. So,
yeah.
but yeah, I mean, consistency has been a big part of it. And then that enables me to be, maybe a little less strict with dietary things too, if I'm getting in there and just working most days too. So, I had probably switched up my eating a little bit too by the time I had come here too. Kind of more high protein, lower carb kind of thing. So, so there had been some changes there that I had already kind of made, which I think probably helped initially with that sort of slim down.
Do you have any specific goals right now?
I think now my goal is to gain back some strength because when I did that marathon training back during this past year, gained a lot in the realm of endurance, but lost pretty significant amounts of upper body strength because I just wasn't working out in the gym as much. So for me, my new goal for this year, and actually works out pretty well because my marathon in the fall got canceled, is I'm
Yeah.
gonna go ahead and just kind of focus on regaining some of that
Okay.
strength that I had lost previously. So.
Mhm. Have you set a plan or program as far as you're going to do that, or how are you going to approach that?
For me, it was pretty much reproportioning my exercise days because before I was, like 4 or 5 days a week running, and now I've redevoted pretty much most of my days to getting in the gym and then
Mm.
maybe having a day of running in there. So it's, yeah, like I said, usually if I do that, that works pretty well. It is interesting. Running is one of those things where it's a great exercise, but it definitely takes, if you do that exclusively, it definitely takes its toll on other areas of your
Right.
fitness. So
Definitely a
yeah.
trade-off between the cardiovascular improvements and the strength loss or
Hmm.
potential loss.
Yeah. And it doesn't take much. I mean, I didn't lose much body weight, but it is pretty impressive. I think it was mostly muscle because it really did take a hit to my strength part of my fitness.
Yeah, a few years ago you were like super jacked. And I don't know what the like weight difference was, but I have to say it was maybe 10 or 15 pounds.
Yeah. Yeah. I think, there was one time where I decided I was going to try to hit 200 pounds body
Uh-huh.
weight, and I actually wasn't very far off. I think I got to like 195 or
Yeah. Hmm.
196, but I felt pretty heavy. I think I feel better living a little lighter. So,
Yeah.
but man, I could lift a so, yeah, I remember throwing around some weights back then that I definitely have to think about it a little bit more now.
Yeah. Were you doing anything? I mean, you were obviously eating a lot of protein and, doing like the mass gaining type of things from a nutrition standpoint. Were you doing any extra work outside of the gym, or outside of regular classes, I should say, in order to like put that weight on or to gain that strength?
I think at that point I probably was doing more accessory stuff. I think that may have been when I was doing some more like lifting, at the gym, but outside of regular class time.
Mhm.
I was following like that. Remember we briefly had that like weight barbell club or something,
Sure.
and
Yeah. Yeah. Yeah.
so we were moving some pretty heavy weight, like a couple times a week in addition to class work, and
Right.
I mean that stuff definitely paid off in that realm for sure. Yeah.
Yeah. It sounds like you, based on whatever your goals are, you kind of have been using the gym or the group classes as just like your base, and
Hmm.
then supplementing with some sort of additional program or something like that as far as like honing in on a specific goal.
That's usually what I've done because I mean, the past couple of years, I've usually tried to have some sort of like fitness goal in mind. Like last year, it was the marathon. The year before, I was kind of doing the whole Spartan obstacle race thing. And so a little less running. And then the year before that, we did that climb. And so that was, I had to do, I try to do, I probably should have done more of it, but I try to do more like load bearing, just carrying stuff for kind of accessory work too.
Yeah.
So,
And what was that climb?
we did Mount Rainier, and that was a lot of fun, but definitely just a whole different modality of fitness that just like being up and going for, 16 hours. It's just a long time on your feet.
You spend a lot of time traveling, either for professional reasons or personal reasons. Is that something that is a priority for you? Being well traveled or experiencing things, or what is that to you?
Oh yeah. Yeah. I mean, and I've been very, lucky that I've able to take advantage of some, actually being able to incorporate, like you had mentioned, work and travel a couple of times too, to some pretty cool places. Like in residency, we did a month in Ethiopia, which was, a great experience. We did, we got to travel, which was fun. But then of course we actually did work, in the main hospital there in Addis, which was once again, it's very useful. I mean, when you train in sort of an American-based system to see how medicine's practiced elsewhere, and so that was a really good experience there too. Yeah, so I mean, work's enabled me to do it, and then yeah, like I said, I've been lucky. I've had some friends who like to incorporate exercise and travel kind of all in one. So
Yeah.
that's kind of been the way I've been able to go to some kind of cool places recently, is just, finding, rewarding myself with a trip after something, like that marathon back in December. So,
Yeah.
yeah, so no, I mean, and um, if I can combine those, fitness and travel, it's a pretty good, I would say that's a pretty solid trip. So,
Right. So just kind of getting back to some of what you touched on earlier, as far as like, this was during residency, you would leave the hospital and, it's been a 10 or 12 hour day or night, and
mhm.
you still come to the gym and do the class and get your exercise in. What makes you actually show up after a long and stressful day when you could just easily go home and chill or nap and whatever else?
Sure. Yeah. I mean, definitely now I'll say it's because maybe I'm addicted, and that's a good thing. It's a little bit of an addiction. It's like your body just won't let you rest unless you get that exercise. So, but of course that wasn't always initially, that way. It's that kind of comes after you've been doing it for a while. But
Hmm.
yeah, I mean, doing what I do, I mean, particularly in residency where I was doing a lot of hospital medicine where you see really sick people. And, a lot of times secondary to, battling with, chronic illness for many, many, many years. And it definitely makes you kind of put your own health into perspective and understand that, granted, bad things happen to people sometimes, but,
Sure.
you certainly, the you have ownership over chronic illness and how much of an effect it can have on your life. And so it's and I've talked about people about this before. I mean, it does help if you're a provider that you can kind of walk the walk a little bit, and you can kind of, I mean, if you're going to be an example for your patients, you don't have to be some kind of crazy getting in the gym every day kind of person, but at least having something you can show your patients that you're taking care of yourself and that sort of thing. I think it has a little more weight when you try to do counseling with regards to lifestyle changes and that sort of thing too. You're not going to come across as a hypocrite.
Right. You have experience to draw from.
Sure.
You've done the cardio stuff, you've done the weightlifting
Yeah.
stuff, you do the high intensity stuff. So it's like you kind of know what works and what doesn't work for different situations.
And it's kind of nice too, because I get plenty of folks coming in with like musculoskeletal injuries, and I'm like, oh yeah, I had that a couple. It'll go away, but it's going to be there for 2 to 3 months. Just kind of, just this is what this, and usually I've got, which is kind of nice too, because I've kind of dealt with some of those aches and pains. I've had to learn, what kind of PT I need to be doing to keep myself healthy. So I can kind of impart some of that wisdom to them as well. So, and also to normalize it a little bit to make them understand this happens to the best of us. And you just kind of got to get back into it.
Yeah, I feel the same way. And obviously I'm not a doctor and I'm not a PT or a chiro or a massage therapist or any of those things, but I go to all those people and, for my own injuries and my own illnesses and things. And you start to learn as you go along. And so it's like, it's a huge benefit to have that experience with clients and be able to say, if they come to you for anything, they say, oh, well, I need to go see a doctor. I was like, yeah, that might be true, but maybe we can manage this just, between our own experiences. So.
Yeah. And I think also people understanding that, like the musculoskeletal stuff, I mean, there's only so much we can do, if you strain your, you're strain your, there are things that, I don't have a magic pill that can make your knee soreness go away. I wish I did. But it really does come down to more functional approaches to fixing those issues. So,
right. Hey doc, it hurts when I do this. All right. Don't do that.
Yeah. Well, and it's funny too, because we like old school medicine, the solution to an injury like you strained your back is, we used to tell people like bed rest for like weeks, which is a terrible thing for a back injury, because you strain your back and then you lay in bed for 7 days and it stiffens up and then you can barely move. And so it's kind of amazing how, even like simple stuff like that, we've come a long way with our understanding of, what the best way is to like actually heal from these types of things.
Right.
Yeah.
So you talked a little bit, maybe before we even hit record, you talked a little bit about being able to bring your experience maybe in the gym or your health and fitness experience to your clients in the medical office. What types of things can you impart? I mean, I know I don't know what it's like being more of like I guess you work for a large corporation. So, I don't know if there's any certain restrictions as far as like what you can or can't do, but just from a personal standpoint, what are like the types of things that you can bring to your clients?
Well, I think probably more of for us, a big part of our day is education more than anything else. I mean, prescribe medications, but the education piece probably outweighs anything I can do with pills, and so I mean, that's a big reason, like I said, why having a base in fitness can be super important when you're trying to come up with a plan for someone to get their blood pressure under control or their diabetes or things like that. So kind of being able to speak to solutions that practical solutions that a patient can take to to improve their health. If you had no experience in it, it would be tough. I mean, it would be tough to really motivate someone to make some positive change that would actually, and I try to lay that groundwork for patients all the time, as far as, I'm going to start a medication for you today for, say, your blood pressure. This isn't a one-way street. I mean, if I start it today and you make positive changes, exercise, lose weight, there's a high probability I can also remove this medication that we start today too. So
yeah,
I think you can get buy-in with, I think, it's unfortunate, but I think, a lot of times I think people think they come into the office and like my prerogative is just to put them on 10 medicines and just fix the problem. Yeah. And it's, that's actually why our job as primary care physicians is a lot tougher, because it's a lot of the stuff that we treat is, you can fix it to a point with medicine, but there really does, like I said, that the last piece is the behavioral change, which is probably more important than the medication. And so it's, being able to get buy-in, just like you guys with getting buy-in with people coming in for exercise, kind of finding what motivates them to want to continue making that change for positive improvement.
Yeah, like you said, it's the education of it, but
Mm-hmm.
I think, and probably in your case as well, it's a lot of re-education. People thinking they know something, and maybe it's a little bit different than what they thought.
Well, I will tell you, I mean, with health literacy, we've let a lot of people down in this country as far as, I'm not saying specifically as like physicians, but as an educational system in this country, like really imparting on people, like, what is healthy living? Like, what's a healthy diet? I mean,
Yeah.
It's amazing. People don't understand, like, just what leads to diabetes, and it's no fault of theirs. They've just never been taught, we don't understand that if drinking, high fructose corn syrup drinks every single day. And like, I mean, that stuff adds up.
Yeah.
And yeah, it's you're right. It's education and also re-education as far as, what keeps you healthy.
Yeah. It sounds like what you do is a lot more coaching as well. It's like, it's not that different from what we do. I mean, the intent is maybe a little bit different, but it sounds like you have kind of a similar job or similar role in people's lives.
Yeah, it's interesting too, because it's also bound up in the dynamic of time structure and schedules too. So we do coaching, but man, you've got to encapsulate it into like a nice concise teaching moment, because with the way we see patients,
You don't have an hour with them. Yeah.
No. It's to put in perspective, and actually, I may have a lot. I mean, there are certain providers who see people even faster, but my typical appointment time is 20 minutes.
Okay.
And that includes, bringing the patient back, rooming them. So my time is probably more like 10 minutes if I'm lucky. So,
wow.
Granted, you find ways to build more time in throughout the day, but yeah, it's I would love to have, an ideal situation would be where you do have that full hour where you can really hang out with someone and really get into things a little bit more. Because, as we were saying, because the coaching is such a big part of their overall health.
Have you considered branching off and doing your own practice ever? Or?
No. That is way more hassle than I would ever want to deal with. I'm actually very lucky with the way I practice medicine, because I really do just practice medicine because I'm not running my own clinic. I don't have to worry about hiring people and like staffing clinics and, doing my schedule. Someone else does all of that. So it's nice. I just show up and I do what I train to do, which is, practice medicine. So there are definitely some benefits to working in a big medical system like this. Yeah, no, I would never want to go private practice. That is, that sounds, more power to you if you can make that work. But no, I definitely like the way I have my little system set up.
Yeah, that's great. So as far as community and the Move community specifically, how would you describe it, and maybe the relationships you've built with other gym members?
Well, it's funny because I don't think a lot of people don't have the experience that we have at our gym, and so I think they find it very strange when like I'll see someone from the gym up, I'll like wave to someone, oh hey, how are you doing? And see someone out in public, and one of my friends from like medicine or whatever will be like, who is that? I'm like, oh, just a gym member. It's like I don't think people aren't used to having the experience where like your friends are also go to your gym. Usually they're going to those Globo gyms where they really don't know anybody, and so
Right.
it's a very novel experience to like also for your gym to be part of your friend set at the same time too. It was big for me when I moved here because I didn't know anybody. Outside of my residency program, so it was very nice to be able to meet and like hang out with not only people that enjoy exercise, but we're outside of medicine. You need friend groups and sort of in different fields. And so it was nice. It was nice to have that, that different outlet. And so, yeah, I mean, I've always, felt welcome. I don't, that's definitely something that's been very strong at our gym for a very long time. Got, people, I've been here for 8 years, and there are plenty of people that have been there longer than that. So it's, there's something to be said about that.
Has your progress or has your dedication affected any of your other friends or maybe your family?
It's a good question. I wish it would pay off for some of my family members more, but no. I think it has. What's interesting too? I'll tell you, like I enjoy working out a lot, but I to be honest, I think I got my inspiration from some of my immediate family members as far as like staying active. I mean, for one, my mom has been a runner pretty much my whole life. And so that was kind of my intro to fitness, was kind of seeing her super consistent, always out there putting the mileage in. I mean, even today when I go home, I'll go run with her on the weekends, and we'll do some, pretty nice, like 10-mile runs.
Oh,
I mean,
wow.
she'll crank it out. So, and then my grandma, who's, in her upper 80s now, is still like, goes that, well, before all of this quarantine started, she was at her water aerobics class like every day of the week. I mean, super consistent. And I mean, she's actually an inspiration. I would love to have patients like all day long that were like my grandma, because I mean, she has diabetes, but completely controlled with diet and exercise pretty much. I mean, she kind of saw that was an issue and really took control of her own fitness in her life. And it's pretty impressive what that can do. And also with longevity. I mean, she's, when you use your body, it's kind of incredible, like what kind of things you can continue to do as you age. And so, I mean, I think, seeing her is a big motivation to me. I mean, in the sense that, I want to be like that when I get to be 88. I want to, just be as functional and doing what I want to do, maybe not driving like she does, but other than that, everything else. So.
Nice. So we can imagine P. Hall doing water aerobics in his late 80s.
No, I'm gonna be going for that ultra. What was the Ultra Masters division that they'll have?
Yeah, like 70 and up or something.
Yeah.
Do you think you'll have like the Jack LaLanne eyebrows?
Definitely going to be doing one-arm push-ups by that age.
Nice. Yeah. Is there anything else you'd like to add to the conversation?
Well, it's been good. It's been good talking. Yeah, like I said, no, I mean, I think I was talking about this, before, or I've told people in the past. I mean, I tell patients this all the time with exercise. You got to find your passion, whatever it is. Not everyone's going to fall into CrossFit or distance running, but find what you enjoy doing, and it's not always going to be enjoyable. Probably majority of the time you're going to hurt a little bit, but you got to find that activity or that exercise that gels with your personality and like something that you'll keep going back for day in and day out. So I think a lot of times we try to like force a certain style of exercise on ourselves, but if it's not your thing, move on to the next thing, and find what's right for you. So, just got to keep moving.
Yes. Well, I appreciate you talking with me. I'm sure a lot of people will listen to this and think, oh, I just thought it was just, it was that rock star that came to the gym. But, that dude's actually a doctor, and, he's got some interesting things to say.
He's a real doctor. I sometimes worry, people see that commercial on TV and they think those are just
You're
hired actors. But no, it's like, yeah, because I actually had to tell people at work that they'd seen me in that commercial. I was like, all those people in that commercial are Georgia providers. They're like, no way. They really did think it was just like someone they hired from Central Casting to come down and do a commercial for the company.
So will all of this media and stuff you've been doing, will that spark any more interest in continuing with Beard Talk Season 2?
Oh yeah, yeah. People have been saying that the first season was a hit, and so they've been asking for it for it's probably been 5 years now.
It's been a while. Yeah.
We've it's been a slow, deliberate process, but Beer Talk Season 2 post quarantine is going to be something to behold.
I'm looking forward to it. All right, man. Well, thanks again for coming on. And
yeah, absolutely.
I'll see you at the gym.
Sounds good.